This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Monday, April 6th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. We begin our coverage of the global coronavirus pandemic in Britain, where Prime Minister Boris Johnson remains hospitalized on Monday after being admitted Sunday for additional testing due to a persistent high fever. His office called the development precautionary and says he remained in charge of the government. Britain has emerged as one of the latest hotspots in the pandemic, reporting more than 600 deaths Sunday. In the United States, about 1/3 of the 9,600 people who now have died from COVID-19 have been in New York City. However, city officials reported Sunday that for the first time in a week, the death toll had fallen slightly from the day before, but there were still nearly 600 new fatalities. Now to Africa, where Reuters says former Libyan rebel prime minister during the 2011 revolution, Mahmoud Jibril, died Sunday after contracting the coronavirus, according to an aide. Jibril, who was in his late 60s, had mainly lived in Egypt in recent years after losing power. Libya's internationally recognized government in Tripoli has recently confirmed 18 cases of COVID-19 and 1 death. The virus has infected more than 3,000 people in sub-Saharan Africa and killed about 100. Aid organizations are struggling to keep supplies and personnel moving in a region where millions rely on outside help for basic care. U.S. President Donald Trump expects rough weeks ahead in the fight against the coronavirus as the number of people who die will likely increase. At the same time, White House officials say they are also hopeful that they will start seeing a stabilization of cases across large metropolitan areas where the U.S. outbreak began. VOA's Elizabeth Lee has the details on what the U.S. military is doing to help fight the disease.
The number of deaths is expected to continue in the U.S., and President Trump says the next 2 weeks will be tough.
We're getting to that time when the numbers are going to peak, and it's not going to be a good-looking situation. I really believe we probably have never seen anything like these kind of numbers.
The U.S. military is helping by sending more than 1,000 medical professionals to hotspots around the country, says Secretary of Defense Mark Esper.
As of yesterday, we decided a few hundred of those would be deployed in New York City hospitals to augment the hospitals there. New
York's Jacob Javits Center will become a 2,500-bed hospital.
It will be the largest hospital in the United States, and it will be run by the United States military.
A Navy hospital ship is docked in New York and another one in Los Angeles to treat people who do not have the coronavirus to relieve hospitals. Any outbreak on board would quickly spread and disable the ship's operations. But not accepting COVID-19 patients have been frustrating to doctors in cities such as New York, whose hospitals are overwhelmed. Esper's position for now:
we're prepared to open them up to COVID-19 patients as necessary.
The U.S. Navy is facing its own controversy over the firing of a captain of a nuclear aircraft carrier because he sent a letter to Navy officials asking for help to move most of his crew off the ship to contain the coronavirus. U.S. Navy officials say they had already mobilized significant resources in response to the captain's previous requests, and the letter, now public, caused more harm than good.
At best, create unnecessary confusion, and at worst, provide an incomplete picture of American combat readiness to our adversaries.
President Trump supported the move to fire the captain.
I thought it was terrible what he did, to write a letter. I mean, this isn't a class on literature. This is a captain of a massive ship that's nuclear powered. And he shouldn't be talking that way in a letter. He could call and ask and suggest.
The firing of the ship's captain quickly became a political talking point for Democrats.
The idea that this man stood up and said what had to be said, got it out that his troops, his Navy personnel were in danger, in danger. Look how many have the virus. I think the guy should have a commendation rather than be fired.
While the military is currently investigating the case, White House officials say they're seeing glimmers of progress in the fight against the coronavirus. In the week leading up to the Easter holiday, President Trump is asking for the public to pray for those who work in healthcare. Elizabeth Lee, VOA News.
With the number of COVID-19 cases surpassing the 1 million mark globally, U.S. President Donald Trump over the weekend addressed the nation on when the worst will occur. 42 states are currently under lockdown orders. VOA's Caroline Presutti has details.
With more than 1 million infected globally and 60,000 dead, President Donald Trump warned of an upcoming apex for the U.S.
This will be probably the toughest week between this week and next week, and there'll be a lot of death, unfortunately.
Meanwhile, the nation's top infectious disease doctor says physical separation is working. Dr. Anthony Fauci suggests everyone focus on a new number to judge progress.
At the same time that we may be seeing an increase in deaths, we want to focus on the effective mitigation is really the number of new cases.
Europe is also being hit hard by the coronavirus pandemic. Germany donated ventilators to Spain, which is planning to extend its nationwide lockdown to late April. Italy says 11,000 medical workers are infected with the virus, totaling 10% of all infections. France is moving patients from large cities to the country. New York, with 114,000 confirmed cases, received 1,000 ventilators from China and Oregon.
This is a big deal, and it's going to make a significant difference for us.
Even so, Governor Cuomo says New York needs 30,000 more devices that can cost up to $50,000 each. On the cutting edge for treatment, though, plans to take plasma from recovered patients and transfer its antibodies to the sick.
We are planning to actually scale that up, and we'll have more information this week.
On Saturday, President Trump spoke with sports leaders who are facing this: empty baseball stadiums in early April. COVID-19 delayed baseball's opening day.
When, if ever, will it start again? Will it start this year, or is it over?
It's not football season, but the Washington Redskins field is now a community testing site for needy patients.
We have a lot of folks that are undocumented, and almost 90,000 residents do not have health insurance.
The president says the next congressional stimulus package should have more money for small businesses, as well as tax deductions for sports leagues. He wants people back in stadium seats.
We have to open our country again.
But every U.S. sport is suspended, just like the rest of the world, waiting for a turning point in the virus. Caroline Presutti, VOA News.
With the coronavirus pandemic nowhere near its end for many patients, the risk of infection has made seeking treatment in hospitals potentially dangerous. This has led to telemedicine becoming more routine. Andres Yakat reports, and Anna Rice narrates our story.
As the coronavirus pandemic continues to spread around the globe, telemedicine is rapidly becoming a vital necessity. Thousands of hospitals in the US, Europe, and China now offer patients a chance to talk to healthcare providers via a video call.
Patients need to limit the number of their visits to the hospital and the time they spend waiting in lines, especially during a pandemic. An online consultation helps contain a pandemic and helps curb the spread of the virus.
But online doctors' visits do have their drawbacks. It makes an accurate diagnosis a bit more difficult, and some people have trouble making online call at all. But the latter problem can be easily fixed with telemedicine services like Teladoc, a virtual healthcare company based in the US. Teladoc representatives say the use of their platform has grown at least 50% in the last couple of weeks. Similar companies like DocASAP are also getting more and more popular.
We did two things. One, we built a platform that covers the capabilities to reduce friction when it comes to accessing the right provider. And then on the other hand, we created an ecosystem of providers and insurance companies coming together so that we can solve the problem more holistically.
Such platforms allow patients to easily schedule a consultation, change the appointment time, deal with health insurance details, as well as consult several specialists. All this within a short period of time.
Because what we are really looking for is how do we make it easy for the consumer to engage with the provider before the appointment and after the appointment. But then once they have seen the provider, how do we make sure that we collect feedback?
One of the main drawbacks of telemedicine is performing tests. But it is not impossible. A Texas mail-order lab test startup company called Everlywell ended up being so successful in dealing with this challenge that it made a $1 million deal on ABC's Shark Tank. The service offers more than 30 types of lab tests. The most common ones are for hormone levels, food allergies, and cholesterol levels. HIV tests are also available, as are reproductive health and stress level ones. All these advances in telemedicine are coming at a good time.
The pandemic has become a forcing function for all of us to adopt these new methods. And I would imagine that this new method will become the new normal.
While telemedicine is expanding massively, roadblocks still exist, and they are enormous, getting it out to areas with little internet access and insurance billing. However, in the current situation, where most people are asked to stay at home, it may save a lot of lives. For Andrei Dzerkach in Washington, Anna Rice, VOA News.
Now, governments, both local and national, increasingly are calling on their citizens to stay home as a way to help slow the spread of COVID-19, and musicians are joining the campaign. VOA's Arasha Basadi turns up the volume on just a few performances.
Performers from the National Orchestra of France hopped online to share their music from home with others in isolation. Kettle drum player Didier Benetti.
We are all together. We want to share something because we need you, you need us, but we are all together. And with this music that we send in the internet, we can keep in touch with you.
In New York, author Casper ter Kuile sent a tweet asking if anyone wanted to learn simple songs one Sunday. More than 100 people logged into his video chat.
You know, when you put it in gallery view, you see lots and lots of people's faces, and I could see them kind of singing along and smiling, and especially folks who brought their kids. It was really sweet to see.
From her balcony in Paris, classical violinist Stephanie Marie Vegan and her two daughters serenaded their neighbors.
What we're doing is a guaranteed antidepressant. Our neighbors see us practicing all the time in front of our windows, but never hear us perform. As a school teacher, the confinement of kids weighs heavily on me. Maybe we can do this more often.
Greek opera singers had jokes performing from home, urging others to follow suit, even if they weren't exactly wearing suits. Tenor Dimitrios Paxoglu.
We at the Greek National Opera say yes to coronas, but no to coronavirus. Stay home. To your health.
These musicians are just a few performers in a global campaign to keep people at home to slow the spread of the coronavirus. Arash Arabasadi, VOA News, Washington.
Asian markets' upward trend Monday extended into Europe as hopes rise that the coronavirus pandemic appears to be easing. British markets traded nearly 2%, while French and German indexes both traded over 3%. The good news in Europe came on the heels of Asia's positive closing numbers hours earlier. Both Japan's Nikkei and Australia's S&P ASX closed over 4.2% higher than Friday, while South Korea's index gained nearly 4%, and Hong Kong's Hang Seng finished the day 2.2% higher. Shanghai's index was closed for a public holiday, but oil markets were trading lower on Monday as Saudi Arabia and Russia continued to be locked in a contentious price war aggravated by falling demand due to the pandemic. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come in sports, We talk baseball in the age of coronavirus. We'll be right back.
Alongside Nigeria, we survive the future with Mr. Soprano. You know what it is, the bad records. Get it on. Too many haters thought that I ain't gonna be here. I'm ignoring the fake track in my pain. I replay. Never fun. Never fun.
Welcome back to Africa 54. Nathan and Katie Mikita are one of many new parents in the U.S. whose child was born during the coronavirus pandemic. Normally a celebratory time, they have both isolated themselves from family and friends to protect their newborn son, Nico. Nathan tells his personal story about how they find joy with their newborn child during the trying circumstances of self-isolation and the loss of his job.
My name is Nathan. I'm a videographer, photographer, content creator based here in Miami, Florida. My son was born March 6th, 2020 at 11:57 p.m. into what we now know to be the global coronavirus pandemic.
There you go. Oh my gosh. Look at that. Hey, look at you.
I work for a hospitality group here in Miami. I was laid off along with hundreds of employees, and there's a lot of uncertainty right now, and it's scary. It's weighing a lot on me and my wife.
We need to have things that last a little bit longer.
Yeah, so we'll get what we've been getting, like the cauliflower, the cabbage. Yeah, so this is how I go to the store nowadays, which is, I don't know, there's a lot of conflicting information out there about whether or not this is even helpful. But I figure it has to do something. And here we go, on our way. My biggest fear right now is, obviously putting my son in danger. And that means making sure that I don't get sick, making sure my wife doesn't get sick. Still no toilet paper. So we're taking all the precautions. We're following all the guidelines. We're cooped up in our apartment. Echo, set timer for 30 seconds. That's my biggest focus right now, is to make sure we don't get sick. We have to stay healthy. That's the bottom line. My sisters, my brothers, my wife's sister, cousins, aunts, uncles, friends, they've never met him, they've never seen him in person. So we're basically sharing through FaceTime.
Hi.
How are you guys?
Good.
Yeah, he was sleeping all day today.
All day.
Uh-oh, well, maybe tonight you won't get by with.
That's what I thought.
High five.
I just wished I could hold him a little bit.
I know.
At least we have it. At least we can spend a little bit of time with our family and friends.
Hi, sweetie. Hi, baby.
Even if it's not in person. I spend a few hours every day looking for work, but it's tough right now. I'm still optimistic and hopeful that my job will come back. At the end of the day, I'm grateful because I'm getting to spend these first few crucial weeks and months with my son, and that is an opportunity that I honestly didn't think I was going to have. So that has truly been a blessing.
Scientists say COVID-19 likely originated through animal-to-human transmission at a wild animal market in Wuhan, China. New studies by the Global Virome Project, a worldwide effort to increase preparedness for pandemics, indicate the world can expect about 5 new animal-borne pathogens to infect humans each year. Steve Sanford has more from Krabi, Thailand.
The wildlife trade in Asia is big business, accounting for more than $7 billion in profits in China alone, according to leading wildlife conservation and environmental groups. But the trade and consumption of wild animals has also become a global threat, as zoonotic diseases, meaning the transfer of viruses from animal to human, are increasing. Most experts are calling for a ban on the trade and consumption of wild animals.
We're not talking about banning deer or duck hunting. We're talking about ending the global commercial trade in wild animals. This COVID-19 started in a wildlife market in Wuhan, China. The Chinese know it. That's why they closed that market, closed all markets across the country, and have banned wildlife trade and wildlife consumption.
Asia's appetite for eating pangolins and other wildlife has led to several virus outbreaks in the early 2000s, including the SARS pandemic. Transmission was believed to have occurred from bats to pangolins and civet cats before leaping onward to humans. None of the past animal-borne diseases have been as widespread as COVID-19, but doctors are hoping new technology will help in developing vaccinations.
This pandemic is spreading faster right now, but we also have better and faster communication in the era of big data on a real timeline that is helping develop our newer biotechnology.
In China's neighboring countries such as Myanmar, wildlife hunting is a tradition, providing food and revenue for local families. But as development increases into the rural areas, the threat of wildlife trafficking conflicts with traditional norms practiced by the local population.
This is our lifestyle. We have no idea about the virus or the disease. It's not our main priority. If they shut down the wildlife hunting, it's going to be tough for us to find food. And we won't have food to feed our children because we live in the jungle.
As China begins easing restrictions in former COVID-19 hotbeds, conservation groups say they will continue applying pressure to permanently eliminate the wildlife trade and the deadly viruses that come with it. Steve Sanford for VOA News in Krabi, Thailand.
Two major genocides are being memorialized in April. The 1994 mass killings in Rwanda to be remembered on April 7th, and the Armenian Genocide of a century ago on April 24th. A husband and wife team of researchers has published oral testimonies from both atrocities and spoke with VOA's Michael Sullivan about insights they have gained from the stories of survivors.
Those widowed and orphaned in Rwanda find solace with other survivors, decades after 800,000 killings. In the middle of a civil war, extremists from the majority Hutu ethnic group turned on ethnic Tutsis and moderate Hutus. That after the plane carrying the Rwandan president, a Hutu, was shot down. There were targeted murders, then widespread slaughter. By April 7, 1994, the militias had set to work. This survivor, who recalls that attackers called victims cockroaches and snakes, said most of his family was killed. He barely outlasted 100 days of terror. Now, these California researchers, who oversaw 260 interviews with survivors like him, have written a new book about the atrocities.
Survivors told us that in some instances, they were actually the godparents of families and of children. And they couldn't believe that these friends would then, under the orders of the government, turn around and kill them.
It was a societal breakdown. This woman, as a child, saw her mother shot, survived a machete attack, and spent months on the run. The authors had published an earlier book based on testimonies from survivors of the Armenian Genocide. 1.5 million Armenians died at the hands of the Turkish Ottoman Empire.
Both of my parents went through the genocide. They both survived. My father was a sole survivor from a family of 9, and my mother, half her family survived.
The story was repeated in Rwanda, but there most killers and victims were Christians divided by ethnic groups, and some Hutu priests helped orchestrate the killings. These researchers say forgiveness is difficult for survivors, and when it comes after personal healing. The first step is telling their stories.
That was extremely important. Everyone who had gone through genocide gave that advice.
The aftermath of the genocide continues. Community groups with family-like structures offer support, but the pain is ongoing.
And it continues at an economic level. It also continues in the sense of trauma.
Regardless of country, there are warning signs, messages of hate.
It's easy to blame a group, find the scapegoat. You know, it's because of the Tutsis, it's because of the Armenians advancing too fast. So that's always a danger sign when we find a group to blame.
Leaving survivors to pick up the pieces. Mike O'Sullivan, VOA News, Los Angeles.
In sports news, the global coronavirus pandemic has shut down virtually all professional sports, leaving a major hole in the lives of fans around the world. One big exception is baseball in South Korea. Some Korean teams are broadcasting practice games on YouTube, and games are attracting a big audience and bringing a bit of optimism amid the outbreak. VOA's Bill Gallo reports from Busan.
Spring baseball. Any other time, it wouldn't be unusual. But right now, this game is anything but typical. This is one of the only professional sporting events in the entire world. If you look closely, there are no fans. This is what baseball looks like in Korea during a pandemic. The Lotte Giants are playing in front of 27,000 empty seats due to social distancing guidelines. Instead, the team is broadcasting the games on YouTube, where they've been a big hit. About 10 times as many fans have been watching compared to the Giants' average regular season games last year.
And people want sports right now. People are thirsty for, especially baseball fans, they really want baseball right now. I like to think that we're just helping them out, and we're just giving them a bit of a fix.
Baseball already incorporates social distancing to an extent. Most fielders stand a dozen meters or more from each other, and there is no sustained physical contact. Most players also wear masks, and for now, the team is only playing against itself.
Washing my hands as often as I can and wearing my mask and just staying clean. That's the most important thing for me right now.
South Korea is one of the few countries where professional sports could happen at all. The country saw an explosion of coronavirus cases, but was able to quickly put out the biggest fires. Now there are flashes of normalcy, previews of what a post-coronavirus world looks like.
I think it desperately needs baseball. We need some distraction and something spring-like.
Springtime baseball, a reminder that happier days could soon be around the corner. Bill Gallo, VOA News, Busan, South Korea.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.